Hi, it's Dr. K from Academic Medical Associates, and today I'm here to talk to you about how to have a successful telemedicine visit. So if you've been putting off going to see a doctor, maybe you're concerned about the risks of going into a hospital or clinic setting, completely understandable, and you're not alone. However, it's never a good idea to put off healthcare that you need, especially when that comes down to preventive care. So that's care for maybe pre-existing conditions that you have like diabetes, thyroid problems, other things like maybe you need to get cancer screening, get a general checkup. You want to talk to your doctor about smoking cessation, losing weight, eating healthy, exercising, mental health symptoms that might have been bothering you and troubling you. Those are all things that just benefit so much more from earlier rather than later intervention. The little step of taking a step toward prevention can save a lot of money. It can save a lot of suffering and a lot of hassle and just help you live your best life. And at Academic Medical Associates, we personally care tremendously about prevention because it's the best way to improve quality of life. So if you're in one of these categories, you've kind of been thinking about seeing a doctor, but you're nervous, telemedicine is a really, really good way to maintain the benefits of seeing a physician while minimizing your risks. You still get that one-on-one connection with your physician. You can get that personal rapport through the video connections. You can see them face to face. You still get all the body language. You still get all that interpersonal communication, but you don't have to drive. You don't have to park, and you don't have to spend money and needless time waiting. Telemedicine, some of the benefits, we can get you at our practice scheduled in pretty much the same day. There's no waiting. You just log into an app on your phone and you are seeing the doctor right away. It's completely secure, so it follows all the federal and state privacy regulations that every clinic has to adopt. Nobody is privy to your information except your physician. And it's really wonderful for talking about symptoms that you're experiencing, especially things as I was mentioning, like mental health, how you've been doing with your diet and exercise. For chronic conditions like diabetes, that matters so much. The other good thing is that a lot of what you need for general screening can be accomplished by asking questions, by the physician asking you questions and seeing how your general, symptoms have been managed. And that's really great because it can help you avoid an in-person visit. Labs can be ordered, medications can be refilled. So if you've been putting off seeing the doctor, but you're running out of maybe your cholesterol medication, set up a telemedicine appointment. We can order a lot of these things without even having to see you face to face. Now, obviously, in talking to some patients, we will need them to come in person because maybe we need to do a more vigorous physical exam. So that is one of the limitations of telemedicine, that we can't do a hands-on physical examination. However, for many patients who have bad controlled symptoms of a chronic disease, that can be postponed as long as certain things are in order. And we'll be able to tell you if you need to be seen in person or if we can handle your case by telemedicine very quickly after seeing you in our appointment. So telemedicine is covered by most insurance plans. It's even appropriate for certain insurances for a new patient visit. So if you want to get established with a primary care doctor, I've been seeing a number of patients who are doing that proactively. This is a great time to do that and a great way to do that as well. So all you have to do for a telemedicine appointment is make sure you're in a well-lit area and you have a phone with an app. You just log in at the time of the appointment and that's it. That's really all you have to do. It's helpful if you do have, let's say you have diabetes and you've been checking your blood sugar, or you have a history of high blood pressure and you want to check you have a blood pressure cuff at home. It's helpful to sort of record some vital signs like blood pressure and blood sugar just to communicate with your doctor, because that will give us a better sense if we need to see you in person. So again, telemedicine, a wonderful way for connecting with your physician, making sure you're being proactive about your health, and a great way to get the care that you need in these uncertain times. So feel free to call our office up, and if you have any other questions about telemedicine or whether your condition is right for telemedicine, don't hesitate to contact us. We would be happy to take a look and get back to you. All right, till next time, Dr. K signing off. Take care.